And good evening, everyone, and welcome to this episode of the Your Health is Important Facebook Live broadcast. I'm your host, producer, and on-air personality, Dr. MJ Collier, and I'm here to answer your healthcare questions. We're coming to you live from my office and studio, and we are going to talk to you about several topics tonight, as always fun, always entertaining. So glad that you are here with us this evening. Thank you so much for taking the time, because we know you have options. Okay, so let's get right to it now. The hot topic of the day. Everybody continues to ask. I'm getting emails. I'm getting questions about the monkeypox. The monkeypox. They are now considering the monkeypox as a STD, a sexually transmitted disease, and they are trying to register it as such. They are trying to get at-risk potential victims treated and vaccinated. The monkeypox vaccine is unique. Most vaccines are for protection only. They stop you from getting it, but once you have it, you just have to go through it. The monkeypox vaccine actually can be utilized for treatment. So, and we already have a vaccine for the monkeypox. So we have a full cadre of weapons to fight this infection. Now, the predominant group that's being affected by the monkeypox happens to be men that have sex with men. So this is a bit unusual. This is, they are not wanting to use that language, not wanting to label it a gay disease, but, 94% plus of individuals that have it are men that have sex with men, usually multiple partners, and individuals that have gone to places where men have sex with men with multiple partners. So that's where that is. They are making the vaccine available now for anybody who thinks they are at risk. But if they deem it a sexually transmitted disease and they make enough of it, because now the vaccine that was stored is not, we're running out of it. So they have to make more and manufacture more. And once it is available, they're going to make it available for anyone who wants to get it. But it quickly has grown exponentially. The last time we had the broadcast, there were only 9 documented cases in the United States. And now there are hundreds, possibly thousands of individuals that have this. And you would think that a disease that requires direct intimate contact would be very difficult to spread. But guess what? As you see, it is spreading. So the monkeypox. Now, the COVID, the coronavirus, we are having some concerns about the COVID because people are having obvious COVID symptoms. They have headaches, they have fever, they have muscle aches, they have body aches, they have loss of sense of taste and smell. They have friends, partners, spouses that are testing positive, yet they test and they have every sign and symptom, but they test negative. And there are reasons for that. One, if you test negative, sometimes the proteins that the nasal kits are testing for are just slow to grow, particularly with the BA.5 Omicron variant of the coronavirus. It takes longer for the proteins that the test for to show up. It also can vary in individuals depending upon your immune status. If you have been vaccinated and, it takes a while, the vaccine is fighting for you, is working on your behalf, yet eventually the Omicron BA.5 variant wins, then you may find that you ultimately test positive. So the recommendation is that you test yourself daily for up to 3 days. If you have 3 consecutive negative tests, then you don't have it. But if you want to answer the question more acutely, you can go into a lot of urgent care places and not the emergency room. I wouldn't recommend the emergency room, but a lot of urgent care facilities and some pharmacies are offering rapid PCR testing, which means you can get your results in a very short period of time, not 3 days later, like when we originally started doing mass PCR testing. There are machines, kits that you can get the PCR test, which is the most accurate test, in as little as an hour in some facilities. So that will answer the question and you will know. But if you think that you have been infected, and I had a personal case of a husband and wife. The husband had symptoms, the wife did not. They both tested. She tested positive immediately. He did not test positive till the 3rd day. And finally, I was able to then get him some medication and treat him. But that is just a perfect example of you can be in the same household. But as I say, common things happen most commonly, and use common sense. If you have been exposed to someone, particularly in your household who test positive and you're having all the symptoms, chances are that you're testing positive. That's one reason. Two, the test taking technique for a lot of these home tests, individuals are not pushing that swab in as far as they need to. They're not leaving it in place as long as they need to. They're not getting accurate testing. Some people are testing their saliva in their mouth, a horrible way to test for the COVID. So I can understand why you might be getting a lot of false negatives. And then the various COVID rapid tests. There are multiple variations that are on the market. Some are good, some are bad, and some work better than the others. So you just have to see which one you have. Even the ones that I think the government sent out, I know that most of the people that have shown me, they have the same one that I have. I don't know whether they sent out various ones from the government or not. So listen, I want you to start queuing up your questions right now. Because that way we can get to them immediately and we'll start engaging. I'm not going to answer it immediately. So but queue it up, and then my producer Havlick, he will go through and screen the questions, and then we'll start doing them. So I want to bring you up to speed on my weight loss journey. One, I think I said last time I was going to play in a tennis tournament in South Carolina, which I did at a very nice tennis facility. And actually, my hope was to survive without injury and be able to complete the tournament. I completed the tournament, survived with no injury, and finished third place. I brought home a trophy. Now, I attribute that to being 30 pounds lighter. And so that helped tremendously because I didn't have to carry around so much weight. I was able to move a little faster than I have been able to move for the last year or so. And so even though there was a lot of festivities around the tennis tournament, particularly in a round robin format, once you lose, you're out. So you can have a good time and party. So there are things like that going on, a lot of food and drink. So I thought that I might gain weight while I was there versus lose weight, even though I was playing tennis every day. But I did not gain any, maintained, came home, and the next day after the tournament was over and celebrating, I think I may have put on a pound or two, no more than that. Immediately resumed back with the diet activities. The Lipodrops Max started this on Sunday afternoon when I returned back to Atlanta, the Lipodrops Max, and then the Keto Max. And I'm still down to my weight, my 30-pound weight loss. And so that was, if you capture with enthusiasm a slight weight loss, anything less than 5 pounds, you can eradicate that before it sticks, for lack of a better way of putting it. So you stay on it aggressively. Don't wait until you have gained back 15 pounds. Now it's going to be very difficult to get that weight off. Whereas if it's just a couple of pounds, I tell my patients all the time, 1 or 2 pounds is nothing but a light meal and a good bowel movement. You can maintain that very easily. And so make sure that you are following those guidelines. If you are on the weight loss journey with Dr. Collier, if you are, go to lipodrops.com, get all of the products that you need. There are various options. And so depending upon what you need, and that is this, how much you'd like to lose. Number 2, how quickly you'd like to lose it. And number 3, how many products you want to obtain to accomplish your objective. And so you take the screening and it will explain to you what you need to do to accomplish your objective. Of course, to overall weight loss, but if you want to concentrate on abdominal fat, lose the muffin top with Lipodrops as our catch phrase. So you can do that. If you want to lose total body weight, then the Keto Max is very good because it puts you in a state of ketosis, just like the keto diet. Now, formerly the Atkins diet, the modified South Beach diet, or South Beach is a modified Atkins, if you will. And then we have the Keto Max, which puts you in that same objective without you having to follow such a strict keto diet. So that's where we are. We are doing well, hanging in there. Again, I put on, this is one of my old shirts, previous shirts, and it's got so much room in it. And so I'm going to donate this shirt immediately after this broadcast. I needed a gray shirt. It was there. I grabbed it. And after I put it on, I was like, oh my God, it looks like a tent. So I think that, again, I've started purchasing newer clothes in slim fit. And again, the collar, I get my entire hand in this collar, and it's very loose. I got my tie pushed up to squeeze it so it's not gapping open. But that is how we have accomplished that objective, which was weight loss. It took me about 12 weeks, 10 to 12 weeks, and that was, following the diet, not as strictly, and that diet being intermittent fasting, eating everything that I'm going to eat within an 8-hour period of the day. Usually I'm trying to do it between 12 and 8 p.m. I really like to have completed anything I'm going to eat that day no later than 8 p.m. I mean, completed eating. I don't want to be sitting down to eat at 8. I want to be finished eating at 8. So now when I go out to dinner, I make my dinner reservations at 6, and I'm completely eating. I don't get appetizers and dessert. I get one or the other, so that decrease the overall number of calories. And I tell you, I get a sense of satiation, or I get full so quickly now that it's difficult to eat even a sandwich at lunchtime. I usually eat anywhere from a half to 3/4 of it, and that's all I can eat, and I feel fully satisfied. So this is, your stomach shrinks, and you learn to embrace the hunger if you're having it. But it's at this point, hunger is not an issue for me. I'm really not hungry. I sometimes have to remind myself to eat something because I don't want to alter my metabolism. I want to. You keep putting fuel in your engine, and you're going to burn that fuel and not store food as fat for later use. And that is the mechanism how you start to accumulate body fat. Objective is to not do that. And now that I've lost it, I'm going to keep it off. Okay, let's get to the questions. Havoc, let's roll them. We're in the show. You're in the show. Thank you once again for doing it. Good evening, Sherry Gamble. Where are you from, Sherry? We want to know. Remember, we ask everybody where they're from. Stevie Griggs, good to see. He's a regular. Ursula Clark Holmes, she's a regular. Rachel Harrison, good evening. Sean Big Time Green, my number one. You the man. I love your name. Sarah Davis, good evening from St. Louis, Missouri. See, Sarah, you know what to do. Hello, Camilla from Cali. Oh, my goodness. We got a California in the house. Ernest Gibbs, Rock Hill Doc. Hello, Rock Hill. Roderick Big Cheat Cheetah. What's up? What's up, Rocket? You the man. Tamika Harvey from St. Louis. Okay. Good friends from St. Louis. I was with the tennis tournament this weekend. Deborah Terry. Hello. How are you? Thank you so much. Willette Carter. Good evening from Lakeland, Florida. Willette, thank you for following up. We greatly appreciate you. Now, you have become a regular now, so I appreciate you. Sherry Gamble from Dallas, Texas. Sherry, you are wonderful. Thank you for joining me, and we hope to answer any healthcare questions that you have. Okay, so thank everybody for being on tonight. Okay, Alicia Turner, if I had gotten both COVID-19 vaccine shots, but now I want to get a booster, but I just get the second booster. Does the second booster work better against the variants? Okay, the booster shots are exactly the same as the primary shots. There's no differential. They're just calling them boosters. To be completely vaccinated, you have to have had 2 shots of the Moderna or the Pfizer, and they now have a new Novavax vaccine that is available. It's a different type of vaccine. It's more traditional type of vaccine. And then, of course, the Johnson & Johnson, which is the 1 shot. The Johnson & Johnson second shot is considered a booster. It's only recommended to get 1 shot, but nobody's recommending the Johnson & Johnson. You get the Pfizer or the Moderna. You get 2 shots minimum. Then the 3rd shot is the first booster. The 4th shot is the second booster. So you would get a total of 4 shots, but they're all exactly the same. There's no change in the formulation. They are talking about creating a new vaccine that's more targeted toward the Omicron variant. That vaccine is not available yet. They're hoping to have it available by the fall and definitely before the winter. But right now, you're getting the same shot as you were getting a year ago. Nothing has changed except the recommended number that you get. At first, it was 2, then 1 booster, now 2 boosters. If you have a history of having had a COVID infection, particularly if you've had one in the last 6 or 8 months since Christmas, New Year's, when the Omicron variant became the predominant variant, you probably don't need a booster. You're probably going to have you at optimal, maximal immune status. Now, as long as you're taking your vitamin D at a dose of 5,000 international units per day. Let me see if I can get this in the frame. 5,000 international units per day. And so you want to do that. There we go. There we go. Doctors D, 5,000 international units per day. Available on this website, lipodrops.com. That will boost your immune system and give you, again, additional boost. Also, our Lipo Immune product, which has elderberry extract, zinc, and vitamin C. Vitamin C. So that combination gives you basically everything that you need to optimize your immune status and help protect you from additional infections. But you should have, if you have 2 shots and you have a history of an infection, you have natural immunity, that optimizes your immune status. One additional booster, depending upon your health status, 2 additional boosters if you're immune compromised in any way, or just have chronic health, or if you're morbidly obese. Great question. All right. When is the best time to take the lipo drops? You take them before you eat. It can be 5 minutes, it can be 15 minutes, it can be immediately before, because they're going to help your body digest the foods and optimize your metabolism so that you're not storing fat. So I routinely say 15 minutes. So if you know you're about to eat, put it under your tongue, hold it under your tongue for 2 minutes, a full drop of fluid, that's 1 milliliter in volume. Hold it under your tongue. Try not to talk. Try not to drink anything for at least 2 minutes. Then prepare your food, order your food. And by the time you get it, it's ready to work. So you can do this at home. You can do it in a restaurant setting. You can do it at the counter at the Waffle House. You can do it anywhere. Again, following that order. That way it's in your system prior to you actually consuming the food, and you'll get the best response. But even if you take it right before you take the first bite of food, you're still going to get benefit. But ideally, you want it to be in place and working for a few minutes before you start to eat that meal, and you will notice a difference. Remember, the original recommendation was just 1 time per day before your largest meal of the day. But people started doing it twice a day because they got better benefit. Then people started doing it 3 times a day, or basically every time they ate, with breakfast, lunch, and dinner. And we noted that the weight loss was faster and more aggressive. So that's how we came up with the formulation of the Lipodrops Max, which has 10 times the potency of the original Lipodrops. And then also we're recommending multiple doses per day. So you can do that. So the thing is, the bottle has enough volume for you to use it twice a day for 30 days. If you're using it more often than that, you're going to need more than 1 bottle. But twice a day will probably give you, a good benefit compared to 3 times per day. But most everybody can do it twice a day. A lot of people eat their lunch away from home. So they may eat breakfast before they depart for their work day. Then they eat dinner at home. So they keep the bottle on the kitchen table. They're ready to go just as they're about to consume some food. Okay, next question. This question is from Winnie King. Winnie says, I've been having a pain on the back of my neck when I turn it to the right and left. The pain runs up the back of my neck, and I sometimes have a headache. Should I be concerned? Yes, Winnie, you should be, but there's a musculature that goes from the neck to the back of the head. It's called the occipital area, and then there's a kind of a line of tissue that goes right across the middle of the back of your head, and then there's another band of tissue, and then there's another band that comes to the frontal area of your head. All of those can be recruited, and you can end up with what's called a tension headache, a muscle tension headache from those areas. This is not an indication that you're having a stroke or anything. I want to make that clear. It's strictly musculoskeletal, because you described it perfectly. It's your neck, it hurts when you turn from left to right. That's when those muscles, you can put your hand right at the top of your neck and your hairline, and just moving that, you can feel those muscles contracting. So this is a postural thing as well. So you want to make sure that you're not walking around holding your cell phone with your head bent down all day. That's what so many people do, and this whole generation is going to have neck, shoulder, and back issues as they age because their postures, that they're constantly holding their head down. And then also your sleep posture. The ideal way to relax that neck muscle and your upper back is to lie flat on your back. If you sleep on your side, you're going to have problems. If you sleep on your stomach, you're really going to have problems, because you really have to turn your head to the side so that you can breathe. It's called a swimmer's position. So you're either like this or like that when you land on your side, and that there's just no way for those muscles to relax. What happens, Winnie, is that because it's unpleasant and uncomfortable, you can't sleep, so you turn from side to side seeking comfort. Now you're hurting, plus you got sleep deprivation. So you're sleepy and you're uncomfortable, your neck is sore, now you get a tension headache. It results in you just not feeling good and probably being a little mean to other people because you're sleep deprived. So very important that you get your rest. You can take an anti-inflammatory such as Motrin, Advil, or Aleve. Try sleeping on your back with a neck pillow. You can get them anywhere now. You used to have to hunt for them, but just Google neck, NECK pillows on Amazon, and you'll get any one you like, 1,000 different options. They have them that have hot pads, cold pads in them. They have some that plug in and vibrate, massage your neck, all kinds of great things. And they're all not that expensive, but it can really make a difference in how you feel. Great question, Winnie. Thank you so much. What is a good dose of turmeric to take daily for it to be effective? It depends on the turmeric preparation. So I would say look on the bottle, and because turmeric is made so many different ways, and the concentration varies. So I would just say, get a good turmeric. Look at whatever the recommendation is on that particular product. It may be 1 tablet, it may be 2 tablets, it may be 200 milligrams, it may be 2,000 milligrams. It just depends. So if you're at a place to get a good education about turmeric, you can get it at a place like GNC or the Vitamin Shop, or just Google it. And but if you Google it, you're going to really be surprised at some of the options that you get, because I've done just that, looking for a dose to recommend of the turmeric, and it's just difficult to do. So that's why I say it depends on what your product is. Okay, great question. Ernest Gibbs, my man. Ernest asked my question regarding COVID-19. With the sub-variant raging, my workplace has no mask mandates and no social distancing. I'm wearing my K95 mask and keep testing negative. Am I safe? Ernest, if you've been boosted and vaccinated and you're wearing your mask, you're as safe as you can be in a workplace. Unfortunately, mask mandates have been relaxed and they are reluctant to resume them. It's almost as if they are just saying, if you catch it, you catch it, take your chances. There's just no urgency about it right now. But what I have seen is people that test positive, they keep them out of work and won't let them back to work until they test negative. That is not necessary. You do not have to have a negative test before you return to work. If you are 10 days out from day one of symptoms, then the virus is going through you. You can't share it with anybody. You are fine, and you should be able to return to your workplace. So I see workplaces so strict about keeping people out that test positive, even though they're past the recommended outlying period. But they don't insist that people wear masks, and they're not social distancing. So you can be the health advocate in your workplace and passively aggressively suggest, since we're having outbreaks of COVID now, why don't everybody go back to wearing masks, or they see you wearing a mask, hopefully they will start to adopt that behavior. I remember when they first relaxed the mask mandate, I was about to take a flight. The flight attendant comes out and announces to everybody, this is going to be the first flight where you don't have to wear a mask. People were literally standing and applauding in the gate area. This was the dumbest thing I've ever seen. So, of course, my family and I, we got on the plane and kept our masks on. But it was amazing that people were so eager and anxious. And then she literally made an apology for the people that were wearing. She said, she was telling people that didn't want to wear masks, do not harass the people who are wearing masks, as if they are the ones that need to be protected. It was, the whole approach was just absolutely incredible to me. So, in doing so, wear your mask, protect yourself, have your vaccine and your booster, at least one. And, that's the best you can hope for. And then hopefully take your vitamin D, as well as your Lipo immune, and that optimizes your health status. And if you get it, you probably won't know you have it because your symptoms will be so mild, but you should not definitely have any issues with as far as being hospitalized or or dying from it. That should not happen at this point. Okay, great question, Ernest. You the man. Sarah Davis asks what I think about intermittent fasting. Sarah, I'm living intermittent fasting right now. If you did not hear my monologue earlier, Dr. Collier has lost 30 pounds over the past 10 to 12 weeks, and I'm able to maintain. And one of the things that I'm doing that is key to what I'm doing is intermittent fasting. Now, intermittent fasting doesn't necessarily care what you eat. Intermittent fasting is more about when you eat it. And the point being that you should eat everything that you're going to consume within an 8-hour period of the day. Ideally, the same 8-hour period every day, but sometimes you have to acclimate and accommodate. My usual period is 12 noon to 8 p.m. So I don't eat anything before 12 noon. I do have a cup of coffee. Don't eat or drink anything after midnight other than water. After 8 p.m. other than water. And that results in a very successful weight loss, in addition to the Lipodrops Max and the Keto Max. So we are living this, and there are people that have great success with intermittent fasting without doing anything else. And of course, there are other people that have reported they've been doing intermittent fasting and their weight loss has been minimal. But some people's metabolism just won't respond to it. They got other issues. Usually they need to have a thyroid checked and a few other things. But for regular people, and that's what I like to talk about, the vast majority of people will respond to an intermittent fasting challenge by great weight loss and losing the right kind of weight, decreasing your body fat, not your muscle mass, losing the weight from areas you cannot traditionally exercise it away from, like under your chin, the back of your arms, the outer thighs for ladies, the inner thighs where those thighs are rubbing. You'll lose all of that by metabolizing fat as your body's fuel versus utilizing muscle and or utilizing the food that you're eating. Okay, great question, Sarah. Chili Will asks, how are you, my king? Oh, he makes a comment. Thank you so much, Chili Will. Man, you all right with me. My question is, how do I feel about Trt shots for testosterone level? Okay, I highly recommend testosterone replacement therapy. That's what TRT means. I think that every man should be tested, and if the normal range on the testosterone is 300 to 900, you can supplement anything under 600. There were a lot of myths about testosterone therapy in the past. They thought that it gave you prostate cancer. They thought that it put you at risk for a heart attack or a stroke. And ultimately, the FDA had to put out a letter saying that no, that after further research, not only does it not cause those things, it probably helps prevent them for a variety of reasons. But testosterone is safe. There were times when people that had been diagnosed with prostate cancer were told they could never have testosterone therapy. Then they said, well, after you've been 5 years cancer free. Then they say after you've been 2 years cancer free. So, testosterone does not feed cancer. So this has been well documented by multiple studies now. So that was just a myth that became common in the scientific lexicon. People were talking about it, but nobody had actually evaluated and looked at it. Once it was actually evaluated and looked upon, they found that testosterone can be used safely, even in people that have a history of prostate cancer. So I recommend and endorse testosterone therapy. I think it's great. Ideally, though, I would like bioidentical hormone replacement and not just testosterone shots. But the shots are a reasonable and less expensive alternative for that. Most people, they can get to start off with a shot as often as 2 a week. You can get them like 3 days apart, then once a week, and then maintenance purposes once every 2 weeks, sometimes even once a month, depending upon what it takes to keep your level above 600. And that varies from person to person. It needs to be monitored and not just wildly take the shots. You need to work in partnership with your healthcare provider so that your testosterone replacement therapy regimen can be optimized and that there's first do no harm. There's no problem. That will increase your muscle mass, decrease your body fat, improve your mental acuity, which means you're not foggy brain. You remember why you walked into the room. You remember where you parked your car at the mall. Also, your libido goes up and your sense of self-worth and well-being. You become the alpha male and you feel like you did when you were much younger. You the man in the room. You are the man and you feel that way. And it's just amazing. Those are things you can't measure. There's no test that tells me that. It just lets you know, and you know how you feel. I have so many male patients that just think this is it's life-changing. They just feel so much better. They feel younger. They act younger. They look younger. But more importantly, they're the best that they can be. They are optimized from that perspective. Great question, Chili Will. You the man. Cheryl. How does Keto Max and Lipodrops help with getting the A1c under 8.6? Okay, other than losing weight, the Keto Max and Lipodrops are not for the treatment of diabetes. Losing weight will help the treatment of diabetes, but being on Trulicity and metformin, Trulicity is the first generation of a class of drugs called the GLP-1s. There are newer drugs for this now. One that's basically indicated for strict weight loss called Wegovy. The exact same molecule on a different name, Ozempic. You've seen the commercials if you watch television anytime after 6 p.m. You've heard the Ozempic jingle. And then there's the new kid on the block, Mounjaro. Mounjaro is a combination of two things, and it has the greatest weight loss. Its weight loss has been compared to that of surgical gastric bypass. So this is looked at as a non-surgical option to achieve the type of weight loss that you would with a surgical procedure without the potential side effects. So these products are clearly indicated for individuals that have diabetes. They will help lower your blood sugar. They will definitely lower your A1c, and they will make you lose weight. So I would switch and update the Trulicity. Trulicity is a great product, but there's just better versions of that molecule available now. He needs to have a conversation with his primary care doctor or endocrinologist, whoever is prescribing the Trulicity, and get an updated product. And that would be, again, the Ozempic or the Mounjaro. 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 So that is a product that I'll show you what it looks like. This is a brochure from the people, the makers of the Mounjaro. If I can get it to show up. There we go. Mounjaro right there. Mounjaro. So this is a great product, but again, the Ozempic, all great for accomplishing control of your blood sugar, lowering your A1c, improving your diabetes, but makes you lose weight. Makes you lose weight in a very dramatic fashion. Great question. Okay. Laura Jackson. Good evening, Dr. Collier. My 75-year-old father is about to begin chemotherapy. Any information to make it easier for him? Also, is it safe for him to get his first Pfizer booster before beginning chemo? Yes, it is. As a matter of fact, he's going to be at risk because chemo will compromise his immune system function. So he needs to be boosted so that he will get the best protection that he can get. So yes, he needs to get his Pfizer boosters. And then the problems with chemotherapy are the inflammation that it causes. So I would definitely recommend taking natural anti-inflammatories. The two most common, vitamin D and omega-3 fish oil. So I would take my vitamin D product or a vitamin D product, 5,000 international units per day. And then as well, that helps. He's getting chemo, so he has a cancer diagnosis. So he could take the vitamin D prescription dose at 50,000 international units per week. One pill, one time per week. And then either continue that regimen, or once he's at a vitamin D level between 60 and 90, he can go to a daily dose of the doctor's D, 5,000 international units per day, vitamin D, and then omega-3 fish oil, a minimum of 2,000 to 4,000 per day. These are natural anti-inflammatories so that the normal cells do not receive damage from the chemotherapy. You want to kill the high metabolic cells. That's what the cancer cells are. They have a higher metabolism than your regular body cells. You want those to be killed by the chemotherapy, but you want to nourish and keep the normal cells healthy so that you don't lose unnecessary weight, so that you still have muscle mass, so that you still feel good and function. You're able to walk, you're able to maintain your activities of daily living. So good luck to your dad. We'll keep him in our thoughts and prayers. But again, he needs to be on those anti-inflammatory supplements. They are compatible with any type of chemotherapy he was getting. I think that most oncologists now start patients with a cancer diagnosis on vitamin D almost immediately because of all the benefits of keeping that inflammation down. So those are the things that I recommend, Dr. Collier's clinical opinion. Thank you. SM states, hi doc, which products would you recommend for those who have recently had gastric bypass, yet the weight loss is slow, perhaps due to metabolism? Definitely. And with that, with the gastric bypass, now gastric bypass only changes the volume of what you're taking in. That means you're forced to eat less because the stomach that was the size of a 2-liter Coca-Cola bottle minimum has now been reduced to the size of a banana. So you literally can't eat as much. It just, you get full, you get saturated, you keep eating, you're going to start vomiting. And so you just can't do that. Now, over time, because the stomach is living, breathing tissue, you can take that stomach that they have chopped down to, for gastric bypass, it's about the size of your fist, actually. It will breathe, it will grow, and before you know it, you can have a 2-liter Coke bottle size stomach again. That's what I call eating around your gastric bypass. There are people that get a gastric bypass, they lose 100 pounds, 120 pounds, and then they start back eating and they gain the weight back, and they stretch their stomach back out again. And early medicine, that was it. That was the end of it. But now there's a whole subspecialty of doctors that revise gastric bypasses, and people who have done that. They've had a gastric bypass, they lost the weight, they gained it back, and they need another gastric bypass, basically. So there are doctors now that specialize in doing just that. So there is hope there, but the objective is to keep the weight off. And so the way to do that is, as you asked and as you stated, is to alter the metabolism. The objective is to have your body burn the food that you use as fuel acutely versus storing that food as fuel, which is fat. So your body then has to break that fat back down to utilize it as food. And your body doesn't like to do that. It doesn't like to do that. It puts you in an acidic mode. You're everything. You just kind of feel blah when that's the predominant metabolism that you have. So the objective is to do that. So the Keto Max will help with that. The Lipodrops will help with that. And those are the products that I recommend. But also make sure that you are keeping your bowels moving. You do not want your bowels to start backing up on you. So very important that you take something like Collier, Metamucil, Miralax, those types of products as well. We have a product called Colon Cleanse. Again, that also will help keep your bowels moving as well. And so probiotics would be what I recommend. The colon cleanse. Those are two things just for overall GI health. The alter your metabolism, the Keto Max, and or the Lipodrops Maximum Formula. The great thing about the Lipodrops, you squirt it under your tongue. You don't have to worry about the plumbing below. It doesn't matter how your stomach is working, how you're able to eat. None of that matters because the Lipodrops are absorbed under the tongue. Great question. Okay, can I take your Lipodrops when I'm on Benicor, ACT, and carvedilol? Well, yes, you can. Thank you so much for that question. Because Lipodrops does not contain stimulants. It does not increase your blood pressure. It does not lower your blood pressure. It does not affect your blood pressure in any form or fashion. It does not affect your cholesterol. It does not affect your blood sugars. So it's compatible with virtually any medication that you could be taking for any disease state. There should not be any conflict, particularly with the Lipodrops. So you can feel comfortable taking it. There should not be any drug interactions, as they say. The Lipodrops, again, just vitamins and amino acids. So those are things that you can get in food sources, just not in the concentrations that you get in the Lipodrops. So you can feel safe, you feel comfortable, you don't have to hesitate. You're on a good combination of the Benicor and the carvedilol. Just remember, the carvedilol is a 2-time per day drug, roughly 12 hours apart. I have so many patients that only take it once a day, and it will not last 24 hours. You have to take that second dose and just come up with a schedule. Roughly 7 a.m. until roughly 7 p.m. or 8 and 8 or whatever works for you. But ideally, you want it to be about 12 hours apart. But if it's anywhere from 8 to 10, that'll be fine. Just get that second dose in so that your blood pressure, you don't lose control of your blood pressure. That means you take one dose, your blood pressure is controlled for about 10 to 12 hours. Then after dinner, your blood pressure starts to go up again, which means you don't have control. You don't have control, you may as well not take the first dose, because lack of control is when you have an event, that event being a heart attack or a stroke. So great question, Larry. We appreciate that. Janae Allen asks, hi, Dr. Collier. Sometimes I have sticky phlegm in my chest and throat. It is so hard to bring up, and I also have a bad case of postnasal drip. Janae, you have allergies, one, so you need to take preferably a non-sedating antihistamine. There are multiples on the market. I'll start with in order of preference, Allegra, Xyzal, XYZAL, Zyrtec, and then Claritin. Allegra plays well with others, works good, particularly if you have skin issues, skin rashes, eczema, etc. Then that will help. So the allergies are what make your body make more phlegm. The phlegm gets dried and sticky, so you need to make sure that you're hydrated. And I hope you're not smoking. But staying hydrated makes the phlegm thin and watery, helps you get it out. If that doesn't do it, then you need to use a mucolytic, something that makes the mucus thin and watery. Products such as Mucinex. I like Mucinex DM. That's with dextromethorphan. It helps with cough, and it will help your chest, your sinuses, and your throat. Whereas the Mucinex D has a decongestant, which can dry you out. So Mucinex DM, not just the D product, Mucinex plain or Mucinex DM, maximum strength. Do not get the generic version. The generic version is only 400 milligram tablets, and you have to take them every 4 hours. Nobody does that unless you're in an acute illness situation. But for maintenance purposes, to keep that phlegm out of your chest, you don't want to have to take it but once or twice a day. And so the maximum strength formula, which is available over the counter, but if you get your doctor to write a prescription for it, your insurance companies will probably cover it with no problem. Okay, Janae, great question. Josephine Witherspoon states, good evening, Josephine. Thank you so much for tuning in to the Your Health is Important Facebook Live broadcast with your host, Dr. MJ Collier. We're here and we're sponsored by Lipodrops. Go to lipodrops.com, the website, lipodrops.com, where you can find information about boosting your immune system function as well as weight loss. We want to get that weight off of you, lose the muffin top with Lipodrops. A lot of people they haven't done their summer traveling yet. They still have time. They're going to make those trips around Labor Day. This is your time now to get on the weight loss bandwagon. You can get those pounds off of you so you can have your beach body ready by the time you go on your trip in September. Okay. Josephine states, after taking generic high blood pressure, I begin to sleep all the time. What could be the problem with the generic medication? Well, the main thing is the generic medications are not the same formulation. They are close to it. Sometimes generics don't even offer a substantive or significant price benefit. It's just that what the companies can say $1 and they're mandating that you get the generic. One, you can defeat that by asking your doctor when they write the prescription to put on their brand necessary or branded product only. That way they cannot substitute, or hopefully they should not. There are states where pharmacies can do that without asking the doctor's permission. That is therapeutic substitution that is inappropriate, yet it happens on a daily basis. So you have to be very careful and conscientious. It can make a difference as to which manufacturer is making your product. So if some manufacturers have high quality control, their product is very close. Let's say it's 90% of what it should be, whatever the parent product is. But I tell you, there are some. They have done tests on some of it is 90%, some of it is 40, 50%. Some of it doesn't have any of the product that it should have in it. It's just got the name on the label. So very important that you find a generic that works with you and for you. But if there's any medication that you take that has a side effect that you can't tolerate, and being sleepy all the time is one of them, then just ask your doctor to change to a different class of drug. There are many medications that are available now to treat and control your blood pressure. You don't have to tolerate feeling bad trying to keep your blood pressure controlled, or feeling bad trying to keep your blood sugar controlled, or feeling bad trying to get your cholesterol down. There's just too many options now of medications that should not have any significant side effects. Because as I tell my patients, if I took a medication that made me feel like that, I wouldn't take it either. I tell my male patients, if there's a medication that I took that took the lead out of my pencil and I couldn't get a functional erection, then I wouldn't take it either. So I understand why people feel uncomfortable about taking certain medications. But sometimes, not sometimes, there's an option virtually every time for something that agrees with you better, that may have less side effects and you should not have any problems with. Okay, Josephine, great question. Kathy London states, good evening. Is cod liver a good source of omega-3? Yes, it is. Cod liver is great. So is krill oil. But there are flaxseed oil is a non-fish-based omega-3 source. So that people that are allergic to seafood can take it and feel very comfortable. Yes, cod liver oil was something that grandmothers across the world used to do. They give it to people. They never got sick. They never got colds. They maintained a good body weight, and their bowels were working just fine. And then we got away from those types of natural things and started waiting and responding only to disease. People, when you're feeling good, acting good, and quote healthy, you don't get anything. Then once you're in the bed with a fever and got nausea, vomiting, diarrhea, then we start trying to treat a disease or symptom acutely. We respond to dis-ease or disease. That is our medical model here in the United States of America. We need to concentrate more on prevention, and that is what a lot of naturopath doctors do. That is what a lot of herbalists do. Their objective is for you not to get sick, so you don't have to worry about taking a prescription medication. But when necessary, Dr. Collier says this all the time. Sometimes I'm a full component of taking various types of supplements, herbs or whatever you like to call them. But those are in addition to, not instead of. So take the prescription medication I'm giving you as well, and you will probably feel better. You should be okay. All right, great question. A great comment, Kathy. Audrey Clark states, how serious is endometrial cancer when it is hyperplasia? Okay. Hyperplasia is a description of the types of cells that are lining the inside of the uterus, which are the endometrium. the two things are not equivalent. Endometrial cancer is not necessarily hyperplasia. Hyperplasia can just be a precancerous condition. It may not be cancer at all. It just may be a thickened uterine lining as a response to various hormonal therapies. So the two things are not equal, but endometrial cancer is serious. It's just right up there with prostate cancer, cancer anywhere under normal circumstances. And the number one cancer is skin cancer, regardless of your history of sun exposure. Skin cancer is number one. Lung cancer is number two now. Lung cancer used to be number one, regardless of whether you have a history of smoking. The pollution is so bad, the chemical exposures are so bad, the things that we breathe in are so bad now that lung cancer is still number one or number two. Then breast for women, prostate for men, and then we start to get to cancer of our internal organs, colon cancer, endometrial cancer for women, and then pancreatic cancers and those types of cancers. So one, take your vitamin D to prevent the growth of cancer cells. Two, get that. That's probably going to result in a hysterectomy at minimum, because you cannot take out a piece of the cancer. And the great thing about it is inside the uterus, which is a controlled spot, you take out the uterus, you remove the cancer in total, you can be cancer free after surgery. Some cancers do not offer that option. Even if you had surgery, you cannot remove it all. And so that is why some cancers aren't operated on. People say, why they just didn't cut it out? Because sometimes you can't just cut it out. It's everywhere. You cut into it. But let's remove one myth. There are people that are saying, grandmama got cancer. As soon as they operated on it, it spread everywhere and she died. No, it spread everywhere before they operated on it. They operated on it, saw that it had spread everywhere, and there was nothing they can do. Sometimes they can debulk a tumor. Say if it's in your abdomen, it's causing obstruction of your colon or your intestines, and you can't eat, and you have a bowel obstruction. So they will decompress you and take out as much of the cancer as they can. But just being opened up and exposing the cancer to air. Now, this is barbershop, beauty shop talk that I'm hearing now. Oh, they exposed the cancer to air and that made it grow. No, that is a myth. That is a myth. So let's make sure that we're talking correctly when we're talking about this very sensitive topic, and that's what cancers are. Great question, Audrey. Okay. Yvonne Lassane, what can I take for positional vertigo? I was prescribed meclizine and I'm now using Dramamine since I don't have any more meclizine. Could I possibly have swimmer's ear? You could, but probably not. Positional vertigo is from the inner ear. Swimmer's ear is the outer ear, which has nothing to do with balance. The middle ear and the inner ear are specifically affect your balance state and the way that you feel. Positional vertigo is a curse. It is a big problem. And meclizine is a better therapy for it. You prescribe meclizine, it means you need to go back to the doctor to get more meclizine. Dramamine is not it's a close but not appropriate substitute for that. So I would get more meclizine, and you can take it as often as you need to relieve your symptoms. Now, also, to decompress the inner ear, you should be using a nasal spray such as Flonase or nasal Cort, and sometimes I will give a patient a mucolytic to promote drainage of the fluid down the eustachian tube. That's my Mucinex again, Mucinex DM, or just plain Mucinex, and sometimes a nonsense. See, the Mucinex will make the fluid thin and watery. Antihistamine will dry the fluid up. So either way, you get benefit from the inner ear. So oftentimes you do that regimen and you will get relief of symptoms. And then as soon as you stop doing it, the symptoms come back. So it's just very important that you stay on top of this, because that means, positional vertigo, when she bends over, moves her head one way too abruptly, the ear gets involved in the cochlea in the ear, which is your balance center, will react and make you feel dizzy. Now, there's two types. One where you feel like you're spinning. Two, where you feel like the room is spinning and you're standing still. That gives you greater insight into what the problems can be with vertigo. Vertigo is a challenging diagnosis to make and a very challenging treatment option, because there's no take this and you'll be better tomorrow. It's usually a process. And sometimes, trial and error, what works, what doesn't work, what works today may not necessarily even work tomorrow. So vertigo can be a challenge. Okay, great question. What's the next one, Abby? Pat Barron Have any of your patients on the start complain about hair loss? What is the best blood pressure meds for Black women? It's not necessarily Black women or Black men. Losartan is a class of drug called an angiotensin receptor blocker, or an ARB. It is a very good choice. I have not heard of people complain about hair loss, but it doesn't matter whether I've heard about it. If you're taking it and the hair loss is happening to you, then the side effect is 100%. That's all that matters. But understand this, oftentimes things like arthritis and high blood pressure, they all come along at the age in which a woman or a man starts to lose their hair. It's aging, the alopecia of aging, if you will, male pattern and female pattern baldness that will happen. So the medication gets credit for what was going to happen regardless of whether you started that medication or not. So hair loss is thyroid disease until proven otherwise. If you get your thyroid evaluated and they are normal, then you start to look at the next cause will be anemia. And then after that, I would look for other issues, such as fungal infections of the scalp, seborrheic dermatitis, those sorts of things. So it's very important that you differentiate between scarring hair loss and non-scarring hair loss. Non-scarring means that the hair follicles are still intact. You can lose hair, but it can come back and it will grow back and it will be the same quality type as you had previously. Scarring means the hair follicles are now covered up. There's a true bald spot. There's no place for the hair to come out, so the hair doesn't grow, and you will end up, that's a permanent loss in that area. So it's very important to make that differential and to work with someone who understands not only hair loss, but hair loss in Black women. Not just hair loss in men or women or whatever. There's a special unique circumstance, things that are more common in African American women, and you want to make sure that your hair, which is already delicate, because all the things we have to do to not have to do, but do to hair, very important that you get that checked out. So find you a dermatologist that specializes in Black hair, and just Google that combination of things, and you will find people that, and look at before and after cases, people that they have treated before, and that will give you some insight as to what's going on with that. Okay, great question, Pat. Carolyn Mitchell, hi Carolyn. Is berberine good to help lower your cholesterol? I'm not sure. I'm not sure what berberine is. I've never heard that word before, so I'm not sure whether it's good to lower your cholesterol or not. I'll do a little research and see what it is. I'll Google it. Okay, if you stop taking the keto, will you gain the weight back? Well, the point of keto, it can be used for maintenance purposes if you like, which means you just keep taking it, but you can stop it. Anytime you're doing anything that's altering your metabolism, the opportunity to regain the weight is there. And that's why it's very important. And I stated this at the beginning of the program. If you see that you have gained, close to 5 pounds, that's real weight. You need to get aggressively back on your weight loss program to get that off of you, quote, before it sticks. If you go out and have a big weekend, you go on a cruise, something like that, you're eating more than you traditionally would. On a cruise in particular, everybody lives for the midnight buffet. Nobody takes in 3,000 calories at midnight under normal circumstances. So that is why you walk on the cruise ship and you waddle off the cruise ship. It's almost, weight loss is inherent, no matter what else you're doing, because you're drinking a lot of cheap calories, drinking these festive drinks that they have, these sweet cocktails, and eating a lot of food. Your body does not recognize the calories that you get from drinking as food. So it's almost like it doesn't count as far as making you feel full. It does count as in making you feel fat. So very important that you don't waste precious calorie intake on things like sweet tea or Coca-Cola. I did a presentation on rehydrants, things that you would take if you were if you needed to rehydrate from exercise, etc. What I found out was, and I had no idea, was that the amount of sugar in Gatorade and Powerade is as great as that in a Coca-Cola or other type sodas. And so those are good for replenishing your electrolytes, but they have far too much sugar in them. And that is why they came up with the G2 formulation of the Gatorade, and Powerade has been reformulated as well. I just saw commercials promoting it, getting a lesser amount of sugar in your body. So again, you can't go wrong with water. There are a lot of now flavored waters that have 0 calories and 0 sugar. Those are great substitutes. But the number one most high sugar, high caloric think that you can drink? Sweet tea. Sweet tea is liquid calories, nothing but basically simple syrup. And so individuals that drink sweet tea routinely, and it's the one drink that you get that they will continue to refill throughout your entire meal. You have to ask for a refill of your Coke or your Sprite or your soda, but they will keep bringing you sweet tea till the cows come home. So it's very important that you modify the amount of liquids that you're getting from something like sweet tea. That is just a total waste of your caloric burden. So to make sure that that's not a problem, decrease the amount and just take it out. Don't half and half it. It's just as bad if you Arnold Palmer it. Lemonade is just as bad in most cases as the amount of sugar in sweet tea. So just be careful with your sugary drink intake. That is one of the things that can slip upon you. People that eat relatively healthy, but they drink a lot of sugary drinks, and they end up either not being able to lose weight or actually gain weight while they're, quote, dieting, because they're getting cheap calories. They're drinking more to avert the hunger, and not eating, they're eating appropriately, but they're just drinking their calories. So very good question. Okay. Gon Hagler, question: a HIDA scan, it came back normal, but still has pain in the stomach, and the doctors think it might be a gallbladder. That's correct, Gon. There are multiple things that are going on in that what's called the biliary tree. A HIDA scan tells you about the bile ducts and even the pancreatic ducts and how they affect your digestion. You can have a big gallstone in your gallbladder. You don't have to have a gallstone at all. You can still have cholecystitis, which is inflammation of the gallbladder. It can be inflamed just like an appendix. It can give you problems. So oftentimes, if they get in there and see that there's no stones, there can be a stone inside the gallbladder. There can be a stone inside what's called the biliary tree. This little tiny stone could be about the size of a pearl or even a piece of rice, and that can wreak major havoc in your biliary tree, cause backup of your pancreatic enzymes, cause backup of the bile that your gallbladder has, and just ultimately cause a lot of inflammation. And I've seen it result in things like pancreatic cancer in various individuals. So if that gallbladder has gone bad, it's just gone bad, and sometimes you just have to get it out of there just to remove that as a problem. So that would be, again, you can have inflammation of the gallbladder, cholecystitis, which means inflammation of, without having a gallstone. And so if the doctor has come up with that diagnosis, they're probably correct about it. They can be removed laparoscopically, which means no big abdominal scar, and that may give you and should give you immediate relief of your symptoms upon recuperating from that surgery. Great question. Great question. Okay, Chris Goodjohn. Chris, thank you so much. That's a great picture of you on the beach, man, where I want to be right now, but I'm not. Your wife is 50 and having some hyperplasias. Any natural ways like herbs or vitamins to take? Yes, there are, but that's not the best treatment option. There are what are called phytoestrogens. These are plant-based estrogens, and all of those symptoms are due to low estrogen. And so plant-based estrogens can help a woman with those symptoms. They do work. There are people and women that they say it's life-changing, but bioidentical hormone replacement therapy, or BHRT, is what she needs. If she gets a pellet, these are pellets that are planted subcutaneously in the skin. She gets a pellet today, she won't have hot flashes tomorrow. That is the great dramatic effect that you get from replacing those hormones that your body is asking for, that your body needs. So a bioidentical hormone replacement analysis, tell her to Google BHRT to find a provider near her, near you. There are ways to do it. You may find that you want to get it as well, because it's going to make her 18 again. She's going to be young. She's going to be hot. She's going to be all those things, and you're going to have to be able to keep up with her. So I always try to do a husband and wife couple when I'm doing bioidentical hormone replacement therapy, so that they will be equally yoked, if you will, and both will have the same new energy level and those sorts of things. So that is where we are with that. Great question, Chris. You are all right with me. Simply Red, last question of the night. Are there any side effects from the Lipodrops? There should be no side effects. It is only vitamins and amino acids. It should not alter your digestion. You should not have nausea. You should not have any issues as far as interactions with any of your prescription medications. The Lipodrops work wonderfully. But let's say you're allergic to the peppermint flavoring in there, or it just doesn't agree with you for whatever reason. So, again, if you take it and you have a side effect, then what I recommend to people, you take it, you hold it under your tongue for 2 minutes. You do not have to swallow it. You can spit it out if you like. And if you do that, of course, in a controlled environment, like the sink, and that's why you brush your teeth in the morning, you wash your face, you brush your teeth, you put the Lipodrops under your tongue, you hold them for 2 minutes. You don't have to swish it around, just hold it in your mouth, then you spit it out, and then you're covered. That the single dose option works wonderfully. Then if you can do that again before your dinner if you're eating at home. But you can also do it, I said, at the counter, at the diner if you like. You can use the Lipodrops anywhere. Again, should not have any side effects, but if you have a side effect, then the side effect profile is 100%. That brings to an end this episode of the Your Health is Important Facebook Live broadcast. We greatly appreciate you joining us this evening because we know you have options. We hope that you have found it informative. We hope we got to all of your questions. Tune in next time. We look forward to seeing you, and look for Dr. Collier's new podcast, Paging Dr. Collier, that's going to air on all podcast networks. You will be able to get it any place that you get your podcast, and we will have great episodes talking about your physical health, your mental health, your sexual and your relationship health. So your political health, your financial health, your health is important, and we're going to get to it. Look for that podcast, Paging Dr. Collier, and you'll hear about it soon. Thank you so much. Once again, thank you, Havlik, for a great production. We appreciate you screening the questions, and we thank all of you once again for watching this Facebook Live presentation. We'll see you next time. Thank you so much.